So today we're going to talk about all things NAD and metabolic function, your background in software and medicine.
I've been in the NAD space for over a decade. By the time we're in our 40s, 50s, and easily when we're in our 60s, you have less than half. We're going to be entering a genre of medicine where things that we thought would happen later in life are happening earlier. We've seen some very rare cases where someone was in full-on liver failure, wasn't able to get a liver transplant, and did exosome therapy, and they did very well and not even need a transplant later on. Exosomes are another part of regenerative medicine, which are basically micropackets of information that tell your body to heal. People view longevity as unobtainable. I want it to be for everybody.
Good morning. Welcome to the Upwind podcast. Today I'm here with Dr. Halland, a double board certified doctor. Is that right?
Yeah, medical doctor.
Medical doctor who specializes in longevity and longevity research. So today we're going to talk about all things NAD and metabolic function, your background in software and medicine, and the future of this space.
Great. Thank you for having me. I really appreciate it.
Give me some background about what you've been doing.
So a little bit about my background.
Sure.
I'm a double board certified doctor. I went to medical school. I did residency. My area of specialty when I did residency was in spinal cord injury, TBI, musculoskeletal, so sports injuries. And then I did a fellowship in interventional spine. So we were doing minimally invasive procedures into the spine, implanting intrathecal pumps and spinal cord stimulators. And after all of that, I kind of realized, wait a minute, didn't think we were actually healing people. We were kind of just controlling symptoms with either a procedure or medication. And I very philosophically and fundamentally believed we should heal the body. And so very early, over 15 years ago, I was very into how the body heals. I then focused into regenerative medicine. Back then it was very basic. It was only things like PRP, bone marrow. It's advanced much further now, and I'll get into that a little bit later. But that pretty much brought me down into my research path because I actually did 2 years of research while I was in medical school. So I extended my time through school to actually pursue that honors in research distinction for my medical degree. And while I was doing that, I then started a software company. So I have a little bit of a tech background as well. GE Healthy Imaginations ended up incubating us because we were a software platform that was putting medical imaging in the cloud. So always kind of had a diverse background of how does technology accelerate healthcare, and then how to innovate in healthcare, which is what brought me into that research background.
Wow, amazing. NAD.
Yeah.
You do a lot of NAD.
Yeah, so I've been in the NAD space for over a decade. You know, when people think about NAD now, it's pretty trendy, but it actually has a very deep roots in the detox metabolic world. So when it first came out, NAD was used as a detox molecule. People who were on opiates or alcohol or things that were very hard to get out of your system, people were using NAD, and you didn't have to use any other medication. You could get off of opiates, you could get off of alcohol, and I'm kind of...
Wait. You can get off of opiates with NAD? How?
Yeah. So it basically flushes out your body. Like a lot of people become opiate dependent because a lot of the receptors get very tightly bound with the opiates.
Yeah.
And so people who have been chronically on morphine or other type of narcotics, you can actually become narcotic free by using NAD. Now, obviously, you still have to treat the pathology, right? So if you're on chronic pain meds because you had surgery or you had something very debilitating, you still have to fix that problem. But some people get stuck on opiates because they become dependent on it, right? Opiates have a very strong dependency aspect.
Of course.
And so when you do NAD, it actually can reset a lot of these opiate dependent, basically helps flush out the receptors. It can help reset this opiate dependency in your brain, right? And so that's why NAD became really popular back in the days. We're talking over a decade ago, longer, is because you could actually detox people off of using NAD off of opiates. So that's still pretty, I would say it's more well known, but I'm kind of surprised that it's not more commonly implemented in the detox world. A lot of the detox world, which is a kind of separate topic, I don't focus on that.
Yeah.
But in general, it's such a great metabolic detox, which when you think about it, the difference between being stuck on chronic opiates and peak performance is just a continuum, right? And so at the end of one continuum, you're very sick and kind of not metabolically functioning well. On the other end of the spectrum, it's peak performance. And so if you can get somebody who's dependent on opiates or alcohol or all these other medications, and you can get them off of it, you can imagine what NAD can do to someone who's pretty relatively normal, or let's say have some sort of metabolic dysfunction, right? Now, we can't make any claims on what NAD can do, but we can see that it can do things to improve your health. It can do things to improve metabolic function. It can improve things like sleep, right? We've seen people have massive improvement in sleep. It's already been known to help improve circadian rhythm. And then obviously from a metabolic standpoint, it helps with DNA repair. It helps the cells function more efficiently because NAD is actually used by mitochondria. Mitochondria is in every cell of our body, and the mitochondria need to fuel the body with a thing called ATP. And NAD is very much responsible for producing ATP in your body. So it's very much a cause and effect. I think what we're seeing in the NAD space is very much what we're seeing now in the oxygen hyperbaric space. You know, back in the days, people thought hyperbaric oxygen might be just for certain conditions and injuries. Now hyperbaric oxygen is used very commonly for peak performance and also helping the body heal.
Wow. Okay, so you spoke about flushing out receptors. You also spoke about metabolic function and mitochondria.
Yeah.
Could you just, for those who don't understand how all of this works,
Yeah.
how does the NAD go through the system
Right.
and power that power plant, which is the mitochondria?
So kind of when we get into the physiology of things, you know, when we consume whole foods, right, non-processed foods, things that are high nutrient dense, these foods actually will be broken down, right, into basic building blocks like carbohydrates and peptides and other nutrients, right? But there's not enough in these to actually have sufficient NAD quantities, right? NAD is considered a coenzyme, so it powers up other metabolic processes in your body. And so when you get NAD in your body, you're either producing it naturally, right? Things like working out can help increase your NAD levels, or you can consume it in your foods. There's certain foods that are very, you know, strong in NAD like components, meaning as a nutrient, but it's not enough, right? As we age, one of the things that happens is we have a pretty rapid decline in our NAD levels. So by the time we're in our 40s, 50s, and easily when we're in our 60s, you have less than half, if probably not more, than your NAD levels. But that's kind of what's the interesting part. We need more research actually to understand metabolic pathways to find out how drastically to decline does our NAD occur in certain ages and what to do to supplement it. Now, what's been very popular in the NAD world are two forms. We have IV NAD, which basically is a very slow version of NAD+. NAD+ stands for nicotinamide adenine dinucleotide, and then we have an oral precursor. And the oral precursors include things like NMN and NR, which stands for nicotinamide riboside. And so these type of precursor products get taken into your body and then absorbed and then metabolized into NAD plus product. There are some other interesting NAD products that are coming out. We've been doing a lot of research on the NAD space where you can actually encapsulate it into a liposomal. And so you can have a very efficient way to take it orally as well. And it's a liposomal version of NAD, which then gets into your body, doesn't get digested into the gut, but then the liposomes can actually get hydrated and help you cross the gut barrier and then into your body. And then that can then get absorbed into the cell as well. So those are the kind of different ways of how NAD can get into your body. There's also ways that you can do it like as a sub-Q injection and even new formats that are being topically applied. So I think it's a very wide open space. I've been in the NAD world for the last 10 years. I've been in the research world for even longer. A large part of my university-based research now is actually going to be about NAD and metabolism. Does IV work better than oral? Does oral work better than, let's say, sub-Q or injections? And I think the big question that we're seeing is, or at least some of the prelim data is that you need both, right? IV NAD I've seen very effective in terms of detoxing the body, flushing out organs, increasing mental clarity, really good for a circadian resetting. Oral NAD is really nice for metabolism, DNA repair, sirtuin activity, which are basically things that help regulate your body's gene functions and also DNA repair as well.
So have you been doing NAD for the last 10 years?
Yeah, probably even longer. you know, I think for me, it's such a daily part of my routine. I do both an oral precursor, but then once a month I do IV just because I travel a lot.
How much? What milligram?
Yeah, it's a good question. I think it really depends on which one you're using. So IV NAD can be anywhere from 500 milligrams to 750 milligrams. Everyone wants to know how fast you do it. I think one of the key things is go slow. We pioneered one of the techniques where you use an IV pump because a lot of people are used to hanging it, but it's a very inconsistent rate. If you do an IV pump, you can actually drip it in very slowly, very controlled. Some people who are quite sensitive to NAD can actually do it overnight. So these are the little unique aspects when you think about it can make the experience very comfortable. So when I hear someone has a bad experience, it's most likely they have the wrong dose, it wasn't infused correctly, it was too fast most likely, and three, they probably didn't use a pump. And that's a very big component of actually understanding NAD because NAD, even though it's considered basically a supplement, it does have some very nice physiological effects, which are, I wouldn't say it's a medication, but it really does have that metabolic effect. So you actually have to treat it seriously. It's not just something that you would go casually take. You want to know this provider actually knows what they're doing. And so when you do the things like IV, you want to know that they know how to dose it correctly. You want to know that they can infuse it correctly. And then likewise, how do you actually integrate that with your overall wellness
Yeah,
program? Functional medicine is a very hot topic these days.
of course.
We do functional medicine, we do all the sorts of testing, so it's part of the program. It's not like a miracle cure-all, but it's basically a very key component of helping your body heal.
Yeah. Okay, what are some of the results? I know we just spoke about opioid addiction, but like for you, what have you the nice physiological
Yeah, I mean, from a physiological effect,
effects?
because NAD is so ubiquitous in your body,
Yeah.
every cellular process relies on it.
Yeah.
We see increased energy, increased mental clarity. People have improved digestion. We do see enhanced recovery. So people who are, let's say, very physically active or doing athletic sports, we see that they recover faster. I think sleep is a really big one because it improves your circadian rhythm. And so having an improved circadian rhythm makes a big difference because now you can sleep longer, have more deep sleep. So that's just some of it, right?
Yeah.
And so even when you think about how much toxins are in our environment, right? We have such a toxic environment world because of the microplastics, the pesticides being used. We have things that are non-GMO, which are being grown in ways that are exposing us to more chemicals, right? And so having the ability to detox these chemicals is not even just about peak performance. That's what we need just to be healthy, right?
Yeah.
And so the big component of being healthy is actually very much built upon the fact that our detox pathways aren't strong enough. So using things like NAD can help flush out these toxins, improve your body's overall performance.
Yeah. Yesterday I was sitting with Dr. Taylor Sittler,
Hmm.
and the podcast was just all about resiliency.
Yep.
And it seems as though the NAD just helps you to become more metabolically resilient,
Yeah, I think
right?
that's a very big one, right? I think resiliency is a huge component in anything for longevity, especially your mindset resilience, right? In that
Yeah.
particular case, in this aspect, I think NAD helps make your body more resilient, right?
Yeah.
Because if you basically clean out all the junk from the liver cells, you help improve kidney function, your mind's more clear because you also have these things like toxin metabolic buildup in your brain, and that gets flushed out in a thing called your lymphatics. Very similar to your lymphatics, which pulls away toxins from your body and you excrete it. Your lymphatics also is very well known to help detox the brain and help slow down the progression of Alzheimer's, right? By flushing out all these protein buildups, which causes these plaques in your brain.
Yeah.
And so I think NAD is a key component in building cellular resilience. And so a lot of part of my research is very much about cellular health and how do we build that healing capacity in your body.
Right. So mitochondria resilience,
Yeah,
is
I would
that
say
basically what it is?
I would say definitely mitochondrial resilience. I would say mitochondrial resilience at the number one part, cellular resilience because it's not just about your mitochondria, and then it's physiological resilience, right? It's
Right.
how your body interacts as a whole and how
Right.
we both. It's a combination of how do we heal, how do we detox.
You're in the functional medicine space, right? NAD is the number one trend at the moment,
Yeah,
right? And seems to be for good reason. It actually works from addiction to
yeah,
metabolic function. Metabolic function seems to be the key to longevity, right?
yeah.
We just saw the breath tests.
Hmm.
It determines how we fight off disease, how strong your immunity is.
Right.
Is there anything else other than NAD that you work with in your practice or that you're researching right now?
So I think that from a research perspective, we're very big into the cellular medicine, regenerative medicine world. We've been doing some stem cell studies. You know,
Right.
stem cell research has been always a very key passion of mine. The number one thing is you obviously have to do it under an IRB approved study, right? And so the big component is that when you're doing stem cell research, you want to have IRB approved studies and you want to do things at a very high level of compliance so that when the FDA looks at it, they're saying, hey, this is to the highest standards because what happens with stem cells, especially if you clone them, right? The FDA will regulate that as a drug, which is
Right.
important to know. And so in the cellular medicine world, I think stem cell therapies will be a very key thing in the future. There are several FDA studies, IRB protocols that are very interesting that we're involved in, and they're studying 4 domains, particularly long hauler COVID, right? That's very not well understood right now, but stem cell therapy can be very effective for that. There is neurodegenerative disorders, Alzheimer's, dementia, that shows a lot of promise. Autoimmune conditions, we've seen a lot of autoimmunity, especially in younger people. I think it's because our environment is so toxic. We're having endocrine disruption. There's a large part of our gut having issues. And so when you have gut inflammation, you're then developing secondary autoimmunity because of foods you're becoming allergic to. And then all the other things in your body no longer function properly. And then the last component is orthopedics. My background being an interventional pain management guy, and then also having a background in musculoskeletal, I've seen cellular therapy work really well in terms of helping the cartilage in the knees, right? And so people think like stem cell therapy is like, oh, let me regrow back the cartilage. It's not just about regrowing back cartilage, right? It's helping regenerate tissue, decreasing inflammation, decreasing pain, and scar tissue remodeling. So these 4 things, in addition to what we can say potentially can grow back tissue, is one of the reasons why cellular therapy will be, I think, the key in the future. And that's pretty much why I've gotten very much more academic. You know, my pursuits in being at a university-based setting was very important to me. Doing academic research, I've always had an academic background. I did an additional 2 years during medical school to have an honors degree in research. So I think that's where this needs to go. We see a lot of clinicians in the medical world stay very focused on one thing, and maybe they don't read as much literature, which, becomes tough because we have so much information with the internet, chat GPT, AI, that patients and clients are so well informed that as a provider, in my perspective, you have to always be curious. And I'm always very curious because I always approach it like, what would I'd want as a patient or as a client or somebody who wants to be healthy? So I'm always patient number one when anything new comes out. I make sure it's safe. I research the data, and then I can even now do my own studies because we're now doing scientifically based studies in academic settings. We actually invite companies to collaborate with us. So we actually create this nice, unique partnership where companies who have novel technologies and maybe they want to do it at a university-based setting to test out their hypotheses, we can help bridge that.
Nice. What's one study that you're working on now or that you've recently worked on that showed some
So yeah,
impressive
my
results?
NAD work. I mean, one of the promising studies that we have now is how is NAD really metabolized in your body? Like everyone on the surface level says NAD is good for your mitochondria. True statement. But what about the difference between NAD plus, the difference between NMN, NR, the delivery routes, oral versus sub-Q,
Yeah.
sub-Q versus IV? What are the differences in efficacy? What are the actual safety standards between them? And is there a different dose between men versus women? Younger adult versus older adult? What I'm seeing now a big trend in is like longevity is just this bucket word. I think longevity is actually very popular among people in their 30s, right? And people would say, well, why would someone in their 30s or 40s think about it? Because what happens in your 30s and 40s predicates what's going to happen in your 50s and 60s and 70s. And so a lot of people think longevity is for people in their 60s, 70s. I see the trend is very much on the younger side because we're seeing younger people are drinking less, smoking less, right? And so I think because we're also in an environment where there's higher prevalences of cancer, there's higher prevalence of metabolic disease, obesity is at a rise. We see more mental conditions in terms of anxiety, depression. I don't think that's just a chemical imbalance. I think mental health conditions such as anxiety and depression is actually related to probably metabolism, environmental toxins, hormone dysregulation, right? Endocrine disruption from having too much microplastics or things in our environment, or heavy metals. And so I think we're going to be entering a genre of medicine where things that we thought would happen later in life are happening earlier, like cancer. And the way that we have to approach it is not going to be like, I've got this new drug, try this new medication or whatever. I mean, these are all important. I would never ever say don't ever underestimate the power of medications. Those are really much needed. But if you could do things when you're younger, even late 20s and 30s, you could probably prevent a lot of these real medical issues, right? Because you'll get diagnosed sooner. And I think that's the other key thing is the diagnosis of these things is very important. And so doing a functional medicine panel, which is not just your basic lab tests,
Yeah.
right?
Tell
It's
me
going to
more
be
about
testing your gut health, right? Your microbiome, doing a really solid hormone assessment. I think every young person should do a hormone assessment because I've seen people even having early menopause, and that's not normal.
that. Like how old?
As early as early 40s. It's not normal to have like menopause that soon, right? I mean, maybe, but it wasn't until usually later, and sometimes even in their 30s, right? And there could be other reasons, right? There's some cause and effect aspects of it, but I think gut testing should be very important, hormone testing, heavy metals, toxin exposure. These are not typical tests that are done usually for people, right? People are just waiting for these symptoms and problems to pop up, but what we want to do is scan them early. I don't even think it's a bad idea to do things like there's a scan called Pronovo,
Yeah, I've done that.
full body scanning. You know, we don't know what we don't know, but at least with that, you can scan your body. It uses AI to analyze if there's any possibility for tumors. There's another test that does early cancer detection with just blood testing, which is basically detecting even up to like down to the cell level, right? You don't need to have like a tumor mass. You can just detect a few hundred cells. And there's even a brand new test that's called MeScreen. That's a mitochondria test. I think everyone should get an absolute mitochondria test for screening because that's going to help dictate where are we metabolically and are there things in our body that are causing inflammation? Can we decrease this inflammation? That's another thing that's really good for mitochondria testing is that we can decrease the inflammation in our body with NAD, right?
Major.
Yep.
Major. So you're saying NAD supplements on a daily basis.
Yeah, I would say NAD supplements on a daily basis.
Is there a particular brand that you like?
There's a few brands that I like in general. I think, you know, if there's some show notes, we could probably list them.
Yeah, that would be great.
I'm a very big fan of not just only doing one particular brand. I'm a big fan of boosters. We have some really good research coming out that's going to show that if you combine NAD with certain molecules like Apigen, other things like alpha ketoglutarate can help really boost it. And so we've been working on even a product that you can take a look at that I think is really helpful. And so we do a lot of advising as well in our research group. We work with companies that we feel are very philosophically aligned with our value system, helping people. Is this cost effective? Is the research really good? So we're always really trying to help bring what I think people view longevity as unobtainable. It's something that's very expensive or super high niche. I want it to be for everybody because the word longevity back in the days, let's say in the 80s or whatnot, we didn't even think about these things, right? People just had a healthier lifestyle. We played outside. We didn't have all this, you know, iPhones and whatnot, which are fine. Like iPhones are amazing. I use it every day, right? But you need a little bit of a digital detox too, right? And so we focus less on, I think, being healthy. I mean, now there's a movement towards being healthy. I think that's why longevity is such a thing. But we've lost so much touch with that sort of daily routine that keeps us healthy, the interaction one-on-one in person, whereas a lot of our interactions have been substituted by Zoom and video, WhatsApp calls and things like that. And so I think when I look at supplementation as a complement to our routine and our health, we're really just giving our body the best chance to be healthy so that we can then do the things that we're very passionate about, right? Interacting with people, maintaining close relationships, being a good family member, things like that. So they all tie into each other.
Yeah, just having energy.
Yep.
Stem cells. Do you have a stem cell practice for yourself, like monthly or annually?
So stem cells are quite interesting. You know, I think a good regenerative medicine practice could include cellular therapy. You know, the laws in Florida in particular are very favorable now. As of July 1st, there's been some updates in legislation where cellular therapy with stem cells can actually be more obtainable, which I think is good, right? Because the more obtainable something is, the lower the costs get driven down. Now, you'll hear a lot of people going to places like Mexico or abroad for stem cell therapy, and they typically had to, right? Because they were cloning cells, there was no protocols to do them. There could be some safety aspects to it, right? A very big thing that I think is really important to know about stem cells is that you have donor stem cells and you have your own stem cells. So donor stem cells are called allogenic. Your own stem cells are called autologous. So in the research world here in the US, especially things that are under IRB approval, being submitted to the FDA, I think the key and the holy grail is autologous, your own stem cells. Why? It's your own DNA, and then you can clone it and you get these massive numbers, right? So some people are doing stem cells in the 20 million, 40 million. The real therapeutic dose is more likely to be in the 200 million, 250 million. That's a really what we call potent dose that can have a high therapeutic benefit if you're doing it, for example, systemically IV.
Right.
Now, obviously my specialty is the joints. I would say a therapeutic dose is about 100 million into a joint, whether it's a shoulder, a knee. And so obviously you have to meet criteria, right? There's certain things from a compliance standpoint that's very important to note. There's certain things from when you're doing these studies and participating in IRB approved studies that are going to go through FDA, you want to know, does the provider actually understand how this works? Is it safe and efficacious, and is it really going to be right for me? And I think that's only a decision you can do when you do enough research and homework, but I think that's why this is actually going to go down the research route in a university setting. And I think Florida is leading the headway for that, because now that the legislation is more favorable to it, right, as of July 1st, you can actually pursue things more intelligently because people are now having more options. I would say with options, you have to do more homework, because I will always definitely err on the side of caution. There's going to be people who say, oh, I like stem cells and I want to open a stem cell practice. Don't go see those guys.
Yeah.
You want people who actually have been doing the work, or maybe are very well versed in it, or I don't know. It doesn't have to be academic. I just happen to be an academic guy, but if someone has a more research-based background, or you can see that they've been in the industry for a long time, it's not like something that just is brand new to them, those are the people I would trust.
Yeah. Okay. When we talk about our own stem cells and creating hundreds of millions of our own stem
Yep.
cells, are you banking stem cells?
Yeah, so I think that's one of the key components. Now, every place that does stem cell therapy or cellular therapy is different, whether it's in the US, from around the world, because it's all related to both a key component. One, technology. Two, compliance. And I'll get into a little bit of both. From a compliance standpoint, you have to be compliant, right? You can't just be giving stem cells, making claims, pretending it will cure everything. Because stem cells don't just cure everything. You have to have indications. Hence, one of the IRBs, well, several of the IRBs, when you're applying for FDA, essentially the goal is to get FDA approval status. It's either autoimmune, long hauler COVID, orthopedics, neurodegenerative, right? So there's a very specific window, right? And there's a thing called right to try. And so you have a right to try act where if there's a certain condition that there's no real therapeutic, you can have the right to try to treat, right? And so it's that plus, very high levels of standards, plus, right? And then when you have that level of detail, you can then undergo stem cell therapy. And so to answer your question, that relates to the banking, because once you achieve that level of compliance, you have a very much like FDA level quality product, you can bank your stem cells. And so one procedure you can do is you can get stem cells from your fat. Now people say, how does fat a stem cell? It's actually not the fat that's a stem cell. Stem cells like to hang around fat because it's soft, it's cushioning, it's warm, there's a great blood supply. Stem cells also like to hang out in your bone marrow. But the type of stem cells that hang around the fat are called mesenchymal stem cells. Mesenchymal stem cells are really great because they can turn into all sorts of things. Connective tissue, tendons, muscle, bone, organ tissue. These are really nice because they can differentiate more. Now, you can also have bone marrow stem cells, which have a combination of hematopoietic and mesenchymal, but it's more hematopoietic stem cells, which are kind of like blood-related products, whereas mesenchymal stem cells are more the tissue-related products. So when you do a mesenchymal autologous, your own DNA, your own cells procedure, it's a one-time harvest. So I like to call it like a mini liposuction. It's literally just a tablespoon of fat. And so that 1 tablespoon of fat can create over 1,000 doses. So even if you did stem cell therapy for 4 times a year, you would have 250 years of stem cells, right? And so for me, that's pretty much a very long time. I don't know if we're all living to 250 years. Personally, I always say my magic number is 111. I just like that number a lot. If I can live to 110 and then the last year is just kind of more that rapid decline, that's kind of more where I view longevity. I view longevity on the health span side of things rather than trying to like live beyond 120. But back to sort of like, what do you do from a stem cell banking standpoint? I look at stem cell banking as your insurance policy, because if anything were to happen to you and you get into a very serious situation or something that's not treatable with conventional medicine, I think the regenerative medicine side of things could offer a large potential possibility, because when we get injured, we naturally produce stem cells. If I get a paper cut, I'm going to have stem cells, right? And so these stem cells are so potent, they help our body heal during times of injury. So when you actually don't have an injury, let's say from a trauma, but you have a medical issue, a medical chronic condition, I think that's where the potential stem cells can really work well. And then the idea that it's your own DNA and you can clone it out to over 200 million, 250 million cells, that's massive. And there's one more key component. Sometimes when people say, okay, I don't want to do clone stem cells because they don't pass the lungs, they get stuck. That's kind of a partially true statement. Just like anything, like not all stem cells are created equal, right? There's a cloning process that's very important. There's how you cultivate the stem cells that are very important. There's the integrity of the DNA that's very important. And so when you're cloning cells up into that high level count, what we see typically in most traditional labs, the stem cells grow very big, but they get very sticky. So they have a tendency to clump. So not only do you not get enough stem cells, right, because there's only so much surface area to grow them, they get trapped in the lungs because they're big and sticky. When you know how to clone stem cells and they have a high level of DNA integrity, they don't mutate, they're very robust, they're very compact. And so these very compact stem cells, which are your own stem cells, your own DNA, can actually pass the lungs and float around into your body, cross the places like the blood-brain barrier, go throughout different tissues in your organs, and then essentially anchor themselves, either repopulate, they can emit endocrine or paracrine effects, which means other cell signalings going into the area. They can release exosomes. Exosomes are another part of regenerative medicine, which are basically micropackets of information that tell your body to heal. And so all these things come into effect. So it's way more beyond just cloning. You actually really have to understand, how does a stem cell grow? How do we keep it safe? What is the integrity of the cell? And then more importantly, can we keep the cell that was cultivated in a lab almost exactly like the same cell that would be in your body growing? And that's the key.
Can we talk about exosomes and peptides?
Sure. Exosomes, very hot topic. Exosomes are these nano-sized particles in your body. They are basically the messaging signal. So from when one cell releases an exosome packet to another cell, it's telling a bunch of things in general to help basically heal. So a lot of people do exosome therapy because it's not actually a cell, it's acellular, right? So the regulatory around that gets a little bit more complicated because it's not really cellular therapy, but it's regenerative therapy. Are you allowed to do it? Can you not do it? So I think that's kind of where people are trying to understand a little bit more. From what I've seen clinically, people who are on exosome therapy, they can have almost the same benefits of stem cells. I don't think it's as potent because it's also the same thing. There's a therapeutic dose. Is it 1 billion? Is it 10 billion? Is it 100 billion? I think 100 billion is kind of the minimal threshold for exosome therapy. 100 billion to 400 billion. We've seen some very rare cases where someone was in full-on liver failure, wasn't able to get a liver transplant, and did exosome therapy, and they did very well. And they actually were able, well, the liver has a very high regenerative capacity too, right? And so we were actually able to see them recover and not even need a transplant later on. And so that's kind of the really interesting thing about like exosome therapy. Now, when it comes to peptides,
wow, that's incredible.
Yeah, it's really
Can you
interesting.
imagine?
I mean, our body has amazing capacity to heal.
If that can work with the liver, I'm sure it can work with other places.
Most likely. I mean, obviously the liver is this very exceptional organ. It has the ability to regenerate itself. But when we think about peptide therapy, which was your next question, peptide therapy, there's, what's very popular right now are GLP-1s, right? There's a peptide.
Yeah, I wanted to ask you about that.
I think GLP-1s are really great for people who are trying to lose weight. Our body naturally produces peptides in other fashions, right? And which is why when you look at peptide therapy for growth hormone, there's a growth hormone like peptide therapy, right? There are things that can help increase testosterone in your body as peptide therapy. There are things that can boost your immune system as peptide therapy. So I think what's happening now, peptide therapy obviously usually is prescribed by a doctor, but we even see consumers going online to find their own peptides, which is very interesting because we're in a consumer-driven field now because consumers are so educated, they may actually know more than some physicians, right? Because physicians might only be specializing in diabetic medications, which is great, or they may only specialize in thyroid medications. But I think we're in a world now where people want to use their body's own healing capacity to heal, and peptide therapy is that signaling to your body, is that messaging in your body to do things, or is that precursor in your body to create that molecule that acts in a physiological way. And so I think peptide therapy essentially could become one of the big things for longevity.
Okay. Lastly, hot topic. Ozempic. Do you have any thoughts on that?
I like it, right? I mean, I don't think it's for everybody, right? I mean, some people who are already skinny are taking Ozempic just to stay extra skinny. I mean,
Yeah.
that probably shouldn't have been prescribed to them. But as a general thing, I think GLPs are quite interesting, right? Because you're talking about one of the hottest medications now on the market, which are helping people lose weight, and obesity is a big problem, right? So I think if you were medically qualified, you were seen by a physician, the dose was properly, given to you, I think it's a great way to actually lose weight. Now, there are some interesting studies now where even low-dose GLP-1s can be a sign of longevity, right? Because really Ozempic was invented to help people who had metabolic dysfunction.
Right.
And so I think the whole idea of metabolic regulatory actions in your body should be supervised by a clinician. And number two, when done correctly, could be quite interesting. I actually think the combination of GLPs plus NAD is very interesting because one is helping someone lose weight, one's helping someone become more metabolically efficient. So when you combine those two, you're taking someone who's completely metabolically dysregulated and putting them into a metabolically healthy state. You've helped them probably in, I don't know, 6 months, then more than like 5 years of their lives, right? Now, I don't think it's this thing that you should chronically be on it, but
do you think you can come off of it?
I think so. I think the idea is like everyone needs to get like a jump start, right?
Yeah.
Because like if you've been having a very hard time, or you're really technically clinically obese, and you don't want to do things like a gastric bypass, which I think is very invasive, these are great non-invasive ways to help the body heal.
Yeah.
So I always say everything has to be medically supervised. Anything in excess without medical supervision can always be dangerous.
Yeah.
You could take Tylenol or pain medications or Advil in excess and it could be dangerous, right? Let's take pain medication. Pain medications in excess causes addiction and dependency.
And you know a lot about that because
yeah, we've seen it. We've seen it in the world where NAD was not just a longevity molecule. NAD was actually truly a detox molecule.
Incredible. Thank you so much. I think I think we covered a lot of ground. How do people find you?
So we're pretty active on social media. So my handle is at Dr. Halland, DrHalland, both on IG, Twitter, and TikTok. I think we're very keen on sharing information, so you can visit us at our website, www.drhalland.com, and that's Holland with an A. And yeah, we really like connecting with people, and we love feedback and learning things.
We can come find you in Miami.
Yep, I'm based in Miami. That's where our headquarters is.
Where in Miami?
We're more in the, we're in Aventura. We have a research facility there. I'm doing collaborative work with University of Miami. So if you happen to be a Cane, come see us down at University of Miami. I'm also on the medical campus.
Okay.
And yeah, very active. And then I travel quite a lot internationally. So doing a lot of talks across the world. So I would say I spend a good 50% of my time on the road, if not more.
Okay.
Hence the reason why I need to be on NAD. I'm into cellular medicine. It's really also, everything I've learned is I've done it on myself, and I just want to share the knowledge.
Yeah, no, it looks like it's absolutely working.
Yep, thank you.
All right, thank you.
Thanks for having me.
Thanks for being here.